According to the World Health Organization's definition, patient safety is a framework of organized activities that creates cultures, processes, procedures, behaviors, technologies, and environments in healthcare that consistently and sustainably lower risks, reduce the occurrence of avoidable harm, make error less likely, and reduce its impact when it does occur. The reduction and mitigation of unsafe acts within the healthcare system, as well as through the use of best practices shown to lead to optimal patient outcomes. Essentially, patient safety is about constantly working to avoid, manage, and treat unsafe acts within the healthcare system. Patient safety practice is a type of process or structure whose application reduces the probability of adverse events resulting from exposure to the healthcare system. Mistake proofing is the use of process or design features to prevent errors or the negative impact of errors. Taxonomy is how we categorize and group different patient safety events. Taxonomy is a science that deals with naming, describing, and classification of all living organisms including plants. Classification is based on behavioral, genetic, and biochemical variations. Characterization, identification, and classification are the processes of taxonomy. Nomenclature is using a common and universally accepted language. Patient safety. Nomenclature is a system for giving names to things within a particular profession or field. For instance, you may have heard of binomial nomenclature in biology class. It refers to the way of referring to living things by two names, like calling humans Homo sapiens. Here we'll discuss some patient safety terms. Adverse event is identifying risks and processes before they happen. Medical error is bad outcome from care. Sentinel event is a major and enduring loss of function. Near miss is an examination of past events. Retrospective analysis is deficient process of care. Prospective analysis could have resulted in loss, injury, or illness, but did not. Difficulty recognizing errors. Lack of information systems to identify errors. Relationship of trust with providers. Shortages of clinical professionals. Concern about liability. Limited capacity on how to use quality improvement tools such as PDSA. A culture of patient safety is lacking. These are the patient safety challenges and concerns. Here we'll see why there are some errors and their reasons as system factors. The complexity of healthcare processes. Complexity of healthcare work environments. Lack of consistent administration practices. Deferred maintenance. Clumsy technology. Here errors as a human factors, limited knowledge. Poor application of knowledge. Fatigue. Suboptimal teamwork. Attention distraction. Inadequate training. Reliance on memory. Poor handwriting. Not who caused the accident but what caused the accident. We cannot change the human condition, but we can change the conditions under which human works.